Hello, Frontline Teach. This is Val again. Welcome to part 2 of General Health Maintenance. In the last presentation, we covered ways to keep ourselves healthy and regular checkups to have. Now I would like to spend some time talking about the differences and similarities between symptoms, causes, and treatments. So, symptoms is a word that gets thrown around a lot. What it means is the things that we notice about an illness. A lot of times someone could be sick, but if they don't have any symptoms, they don't realize that they have a particular illness. But not all symptoms point to the same causes. The same symptoms can have different causes. And so a cause is, something of where an illness comes from, and the treatment that we use depends on what caused the symptoms, what the cause of the illness is. So, understanding the difference between symptoms and causes can help people make good decisions and get the most out of their medical care. So, what are the symptoms that would make you go to the doctor? Well, if you answered any of the following, you're right on track. Fever over 102 degrees, a cold, something that feels like a cold that lasts more than 2 weeks, significant diarrhea and or vomiting for more than a full day, chest pain, obviously, difficulty breathing, change of mental status. There's a question here, what does this mean? And in short, that is that we're not talking about moodiness, right? We're talking about this is someone who generally has a good outlook on life, and lately, not just today, not just for 20 minutes, but lately, over the past couple of weeks, they've really had a bad outlook on life. For instance, that would be a change in mental status. We could also qualify parts of this as a change in mental status being they used to sleep really regularly and now they have total insomnia and can't sleep at all. Or they used to have a solid appetite and now they don't have good appetite at all. So what this marks is serious and clinical depression. And that's something that doctors are trained to deal with. So change of mental status is a really fuzzy phrase, but those are some of the things that it could mean. We recommend folks go to the doctor if they're experiencing unintentional weight loss that has lasted for a month. Someone loses weight that they didn't mean to lose and can't afford to lose, and it doesn't fluctuate back up. Side effects from the drugs would qualify someone to go to the doctor. Fever, weight loss, and cough at the same time. Blood and stool. Discharge from the penis or vagina that burns or itches or has a bad odor, sharp abdominal or flank pains, and one-sided weakness or slurred speech, which would be the sign of a stroke. So these are all things where if I'm working somewhere doing outreach and someone describes having one of these things, I'm going to call their doctor, and if they don't have a doctor, I'm going to call the emergency room. These are all serious warning signs. So these are very serious symptoms, right? And not every symptom is as serious as this. So we can often use treatment to treat symptoms. Sometimes they don't attack the cause. For instance, if someone has a cough and they take NyQuil, the NyQuil doesn't actually address the cause of the cough. It addresses the symptoms of the cough. It helps the cough to feel less irritating or to decrease in some way. Alternately, if someone has allergies and they take decongestants, that doesn't make the allergies go away. It just helps their symptoms to be less pronounced. We can also sometimes actually attack the cause, which would hopefully relieve the symptoms. So, for example, if someone's having an outbreak of herpes, acyclovir doesn't just treat the symptoms, it actually attacks the cause. It seeks out that virus and hits it. But if we don't know what the cause is, we might not use the right treatments. So here's a case study. Lauren has a rash. Okay, so a rash is a symptom, right? That's something that you notice. But what's causing the symptom? Well, in a rash, a lot of things could cause the symptom. It could be a side effect from a medication. It could be a contact allergy from the laundry soap that she uses. It could be a fungal infection, like ringworm. It could be a viral or a bacterial infection like herpes zoster or syphilis. It could be something that isn't even on this list because we haven't thought about it, right? There are many things that could be causing that rash, and until we figure out what the cause is, any treatment that we give is not necessarily going to be the right treatment. So that's why we go to medical providers, right? They're trained in diagnosing illnesses. We do not diagnose ourselves. We're not doctors ourselves. We can help people to understand what symptoms are and recognize common symptoms, but we can't train you to diagnose anyone. And the bottom line here is that if a symptom is bothering you or if a symptom gets worse, it's time to get to a medical provider. So here's another case study: pneumonia. Okay, pneumonia is a condition or a set of symptoms. Meaning it's not just one thing, there's multiple symptoms that are involved. The word itself means fluid in the lungs, and so if someone has fluid in their lungs, then air can't pass as well through the lungs and someone could have trouble breathing, and the water that's in there, the fluid that's in there, is a warm and wet place, and we know that pathogens, bacteria, viruses, funguses, love to grow in warm, wet places. So that can be potentially, make someone potentially get sicker. But, like it says, bacteria, viruses, funguses could all grow there. So just because someone has pneumonia doesn't mean we know what it's from. Those are the symptoms of pneumonia: fever, cough, fatigue, and shortage of breath. But most people who have pneumonia recover when they find the right treatment. But finding the treatment depends on the cause. So, multiple things can cause pneumonia. A bacteria could cause pneumonia. Viruses could cause pneumonia. Fungus or protozoa, and this is pneumocystis is a fungal infection. That's PCP pneumonia. That's a very common opportunistic infection in folks living with HIV. So it can take a while to figure out the exact cause, and it might mean that we have to culture the sputum to figure out what is causing the pneumonia. Sputum is material, gooey material from the back of your throat or down your throat. And when I say culture it, I mean we put it in a little petri dish and we put it in a warm place and look at it every day and see what grows out of it. So it's a very gross job, but crucial for figuring out what the cause of this pneumonia is. So if they look at the sputum sample and they see bacteria start to reproduce, then we know that it's a bacterial pneumonia. It's when we see fungus, we see little pneumocystis reproduce in that sputum sample, that we can tell that it's a pneumocystic, it's a fungal pneumonia. And someone who's living with HIV may be treated what's called presumptively for pneumocystis pneumonia before the sputum sample is finished growing, because they're living with HIV and PCP is a very common illness. So now you should go to Moodle and complete the exercise there, and let me know if you have any questions. See you later. Bye-bye.